a lot of the exposure I've had to hospitals and medicine and healthcare has made me realize that the change doesn't just happen in the hospital or in the operating room. It starts from the institutions themselves and how they're structured and how the systems are built. My name is Anais Ouedraogo, and I am from Burkina Faso, and I'm currently residing in Toronto, where I've been for the last 2 years. I work hybrid, so I'm usually in the office maybe 2 or 3 times a week. I currently work at Deloitte, and there my day-to-day mostly looks like a lot of meetings, a lot of project management pieces. So I help organize programs to sort of drive business insights and the goals of the business itself. So it will be like, creating decks, working on data migration projects, attending meetings, just like talking to people, getting feedback, creating programs, delivering programs for like partners and clients. My research assistant role is at the Black Health Equity Lab, which is based in Scarborough, at the University of Toronto Scarborough campus. And I've been working there for about 2.5 years, working with professors and other students and PhD students as well. And I also work out of the Faculty of Social Work lab, the Factor Inwitash lab at the University of Toronto downtown. And there I'm currently working on quite an exciting project or an exciting research initiative. We're looking at creating participatory mapping workshops for sex workers in Congo, and kind of like providing educational pieces, healthcare pieces for them. So that's been what I've been busy with, yeah. I recently actually got my first ever research grant, which was very, very exciting. And I hope that with that money I can carry out a project in focusing either in Congo or Burkina or Kenya. And that would be focusing on sex worker stigma, which is what I'm currently working on at the Faculty of Social Work here at the university. So I want to carry on with that project and expand it to. It's currently just in Pointe Noire, which is in Congo, the Republic, and hopefully extend that to Kenya and Burkina as well. I'm currently a student at the University of Toronto. I'm in my third year studying a bachelor's in cognitive science, computational cognition, and global health. And coming here and taking some classes in global health, but also taking classes in computer science allowed me to kind of see that overlap between healthcare and technology. And especially in our day-to-day world, technology is the future. It's fast evolving. So understanding how healthcare can be digitalized is really important, especially if we want to optimize service provision and delivery and also allow patients to really own their health. So that's why I kind of chose those two majors, and they really go hand in hand in many ways, which is great. There's a lot of invisible issues that we really need to work towards improving, and so hopefully I can work on that. Going back to me wanting to do healthcare management before I do medicine, it's also to get that knowledge on how we can improve the infrastructure of our healthcare systems at home, saying back home as in back on the continent. Just really, really trying to improve the system from the ground up would be an aim of mine. And I would definitely like hopefully eventually go back home, reside there, and be able to help do that change from there. So growing up, I was exposed to healthcare through my parents. They're both doctors, and just kind of seeing them, their day to day, the work they're doing, and seeing what drives them and that passion. That was my first exposure to kind of medicine and healthcare. And then just from volunteering with kids and volunteering at like hospitals and clinics, I really felt connected to people. I'm a big people person, so just that connection to people really, really kind of inspired me to pursue that. There's a lot of disproportionate diseases that affect the Black community, especially, and other minority communities. And it's important that we have people that look like us in those places in the healthcare setting that can help and drive that change as well. I lived in London for about 5 years. I moved there in 2015, did high school there. Before London, I lived in Congo, in Brazzaville, for about 4 years, Since my family currently resides there, so we moved there in 2011 from Burkina Faso. Toronto is interesting. It's a very busy city, so it can get quite overwhelming. I really like the people. I love the culture. There's always something to do. There's like there's not a boring day here. And compared to London, I'd say Toronto is pretty similar. It's kind of like a copy paste pretty much, except for like maybe the weather and the food. It's kind of the same. And I'd say the best would just be Congo, just because of the weather. I love warm. So having constant mid 20s to 30s, that's great. And I was lucky enough that we lived by the beach side. So having that close by was really nice. And nothing tops African food. So like, if we're talking about food, Congo all the way. Yeah. London, as a student, I feel like my life was very sheltered. It was just, school. It just revolved around school. I was in boarding school there, so um, it was pretty difficult because my school was predominantly white, so there were not a lot of African students. There were only a handful of us, about six in the entire school actually. So it was very different. It was a culture shock moving from Congo to there because obviously back in Congo I went to an American school there, but the majority of the students were black or African. So moving to London was definitely a culture shock. Um, and I feel like, especially being young, you don't really realize you're not aware of like you're not aware of what you look like until you experience things that make you aware of what you look like. So I'd say there were instances, for example, in school where like students would like people would make insensitive comments, and then it's something I've never experienced before, and I'd be very confused. Like I'm just like a 16-year-old high school student, and somebody's like making a joke about my skin color, and then I'm just like don't really know how to deal with that or how to address it. And what I'd say was different about how I experienced that in London and here was back there the awareness was there, but people kind of shied away from talking about it. So if I'd like go and maybe say that, oh, somebody has made this comment to me, it was really hurtful, then just be like, oh, they didn't mean it, like just move on from it. Here it's much more where in Toronto discussions about race happen. Like people sit down and talk about race. There's purpose, there's intentionality in like having those conversations, those discussions, and creating spaces, especially for students like me or young professionals that are from back home or just like are black or African. So I didn't really have that in the UK in back in London, but here the diaspora is very we're very united. I'd say like from across the continent we're very united here. So working at Deloitte has been very interesting because it is a very big company. It's very big and it's very corporate. Corporate life is very, very structured. It's the way it's pictured is pretty accurate. Um, it's very Eurocentric. Something that was interesting recently was when we were working on one of our program deliveries, and we were trying to see which faculty and partners we would invite. And partners are like, the top people at a consulting company, and there were like such a vast pool of people to choose from, and there were maybe two women and no person of color, not even like black or brown or anything, just no person of color at all. And that was very shocking, and that's something I see in my day-to-day life. And it's quite a struggle because I feel like mentorship is a very, very important part of I'm still a student, so mentorship and teaching is very important to me. And it's much easier to feel mentored by someone who looks like you and want to work with people who look like you, but also it's much more comfortable. I haven't experienced any discrimination or anything like that, but just like being aware, and also having imposter syndrome, that's been another struggle. There's this term where people are sometimes like, am I hired because I'm a diversity hire, and sometimes that pops in my head and I'm just like, is that possible? And then you kind of like start doubting yourself, which is not great. Even here at the University of Toronto, like I don't really there's not a lot of black students in my classes or professors, which is really sad, honestly. So it really makes you doubt yourself sometimes. I'm really lucky that the university is great at okay, you know what? I wouldn't say the university is great at it, but us as black students, as African students, as minorities, we are really great at coming together. And I've been lucky enough that here I've met so many amazing people. I've made friends for life, and I've really made a solid community, especially through I'm in the African Student Association. I work with them organizing events, mentoring events, networking opportunities, and I also attend a lot of events organized by the Black Student Association. There was recently a really great initiative where one of the professors, who's from Nigeria, created a creative writing workshop for Black students, which was great as well. And that's also how I got a little community in that. But yeah, in Toronto, I've built a really nice, solid community that I'm really appreciative of. I did write in an epidemiology course in my second year. I wrote a paper on malaria in Burkina Faso, actually, on malaria in Burkina and the landscape currently, and it's not very addressed. Like malaria is one of those diseases that's like another thing that I've noticed working here is the us versus them narrative, where it's like, oh, that's a disease that's in Africa. Like we don't need to like there's no need to like have funding for it or research it when it doesn't affect them here. But we've seen with COVID that we need to be in this together. Like diseases can easily spread, it can easily turn into a pandemic, and it's really important to still provide that help and support. So yeah, that was a very interesting paper. It was an epidemiology course. So I was looking at the prevalence of malaria and sort of like where it's going, looking at trends and kind of like do some models, prediction models to see where it's going, how it's improving, if anything, which it's not, unfortunately. It's still very much a very a very concerning disease. Yeah. The end goal is hopefully to work in medicine, um, not necessarily just as a doctor, but just in that setting. So hopefully I can be a surgeon. That would be amazing. But that's far down the line. That's very far down the line. And for now, what I'm looking towards is pursuing a master's in either public health or an MBA focusing in healthcare management, because a lot of the exposure I've had to hospitals and medicine and healthcare has made me realize that the change doesn't just happen in the hospital or in the operating room or anything. The change starts from the institutions themselves and how they're structured and how the systems are built. So doing a master's in either public health or healthcare management would allow me to kind of understand how the system works more and hopefully be able to help better that way. So I would hopefully be working in healthcare consulting would be what's next. And then beyond that, fingers crossed, surgery. Yeah.